Aloha, my name is Jordan Dujan, and today I will be presenting my two original field training products. The first is a billing and coding guide for sexually transmitted infections for healthcare providers, and the second field training product will be a instructional guide on how to create or update a billing guide. So for today's presentation, I will be going over the overview, my first original field training product, what are sexually transmitted infections, common codes for billing, common codes for current procedural terminology, examples of coding scenarios, my second field training product, and the five master of public health competencies. I will then be finishing off with a reflection and my contact information for any questions. A healthcare provider billing manual is crucial since it could aid physicians and other staff members in maintaining a seamless revenue cycle and recovering all payments for high quality services. The purpose of this manual is to aid healthcare professionals in charging for STI services by ensuring a seamless revenue cycle and recovering all payment for top-notch sexual health services. This manual can help achieve the desired result. Since numerous factors include coding decision, the material offered here is not meant to be legal advice or a comprehensive billing guide. Rather, it is meant to provide general information to be taken into account when coding for STI-related services. Each case-by-case coding decision must be backed by the proper documentation in the patient's medical file. Sexually transmitted infections are diseases that spread through sexual interaction between people who have had close physical contact. Sexual contact, including anal, oral, and vaginal sex, are the main way that STI are transmitted. During pregnancy, childbirth, and breastfeeding, some STIs can also be passed from mother to child. According to James C. et al., a person can have an STI without showing symptoms of disease. Common symptoms of STIs can include vaginal discharge, urethral discharge, or burning in men, genital ulcers, and abdominal pain. STIs refer to a pathogen that spread through infection through sexual contact, while sexually transmitted disease, STDs, refer to a recognizable disease state that has evolved from an infection. Healthcare professionals are essential to the prevention and management of STIs. Anyone who engages in sexual activity should be informed that they could become infected with a STI. Many patients with infections may not show any clinical symptoms or indicators. By performing STI screenings on individuals, medical professionals or healthcare professionals can provide and treat infected people before they experience serious side effects or spread the illness to sexual partners. And this is really crucial for pregnant women and their unborn children. Syphilis. So Treponema pallidum is a bacteria that causes syphilis. Without proper treatment, it can have major health consequences, especially for the unborn child of infected woman. Syphilis case reports in the US have risen steadily since they hit an all-time low in the early 2000s. Syphilis still has severe repercussions on males who have intercourse with other men. But cases of the disease have recently grown among men who have sex with women and cisgender women as well. The four phases of syphilis are primary, secondary, latent, and tertiary. At the site of infection, primary syphilis frequently present as a solitary minor ulcer or a cancer. Condylomata, lymphadenopathy, and a skin rash are typical secondary syphilis symptoms. Heart involvement, gumatoid lesion, tabs dorsalis, and widespread paresis are all signs of tertiary syphilis. Syphilis does not display any outward symptoms or signs while it is latent. Syphilis can easily be spread through person to person during vaginal, oral, or anal sex. Chlamydia is a prevalent STD that can affect both men and women. The reproductive system of a woman may suffer long-term harm. Later pregnancy may be challenging or impossible as a result. Additionally, chlamydia can result in an ectopic pregnancy that could be fatal. Chlamydia is the most common bacterial infection disease to have been documented in the United States, which is most common in people under the age of 24. The most severe side effect of a chlamydia trachomatis infection in women are pelvic inflammatory disease, also known as PID, ectopic pregnancy, and infertility. Asymptomatic upper vaginal tract infections can occur in some women with simple cervical infections. Infections without symptoms are typically seen in both men and women. The gram-negative bacteria, Neisseria gonorrhea, which causes gonorrheal infections, spread through sexual activity or perinatally during vaginal delivery. In the United States, the reported cases of gonorrhea have sharply increased in recent years, particularly among sexually active 20 to 29 years old. Many patients exhibit little or minimal symptoms, and they may unintentionally spread the pathogen. The 4 clinical locations where gonococcal infection occurs most frequently are the urethra, cervix, throat, and rectum. Given that gonorrhea has become resistant to almost all of the antibiotics used to treat it, antibiotic-resistant gonorrhea is regarded as a critical public health issue. Infections and swelling of the upper female vaginal tract occur as a result of the medical condition pelvic inflammatory disease. The ascending transport of germs from the vagina or cervix to the tissue of the upper female genital tract affects the endometrium, fallopian tubes, pelvic peritoneum, and in some circumstances, the tubal ovarian abscess. This causes swelling and infection of the endometrium, fallopian tubes, pelvic peritoneum, and in some cases, a tubal ovarian abscess. Ectopic pregnancy, infertility, and persistent pelvic pain are PID side effects. Men who suffer from acute epididymitis have discomfort, edema, and inflammation of the epididymis. The term epididymyositis describes a condition that sporadically also affects the testicle. Men with quick onset of epididymitis symptoms should retain a high index of suspicion for spermatic cord torsion, since this condition is a surgical emergency. Men's infertility due to epididymitis is a rare complication. Some common codes for billing. If a patient comes in with a chief of complaint of contact with and suspected exposure to infection with a predominantly sexual mode of transmission, the appropriate international classification of disease 10th provision ICD-10 code would be Z20.2. In another case, we would use the ICD-10 code Z20.2 for contact with and suspected exposure to venereal diseases, exposure to disease that is predominantly sexually transmitted. In terms of sexually transmitted infections and related conditions, we could use A60.04 for herpes viral vulvovaginitis. And these are just some of the various ICD-10 codes. These are common when used for screening due to an increased risk of infection. If we wanted to screen for HIV, we would use the ICD-10 code Z11.4. If we wanted something for an encounter for adult medical exam with abnormal findings from the screening, we would use the ICD-10 code Z00.01. And lastly, if we wanted to screen for someone who is high risk in heterosexual behavior, homosexual behavior, or bisexual behavior, we'd want to code for those three. And those three codes for the ICD-10 are Z72.51 for the heterosexual, Z72.52 for the homosexual behavior, and lastly Z72.53 for the high-risk bisexual behavior. Some common CPT codes. So if a doctor were to collect blood samples from a patient to run various tests, the proper CPT code that we would use would be 36415. This code is associated with the collection of venous blood by venipuncture. If a male needed some drug supplied, the proper CPT code for an injection would be for subtraction sodium per 250 milligrams would require the CPT code of J0696. If a female patient came into the clinic or a doctor's office and wanted a contraceptive pill for birth control, then we would use the CPT code 6S4994. When it comes to procedures, medical visits, counseling, clinic visit, the CPT codes target more than just one area. So for example, the CPT code for 99201, we can use that for office or other outpatient visits for the evaluation and management of a new patient, which would require three components: a problem-focused history, a problem-focused examination, and straightforward medical decision-making. Counseling and or coordination of care with other physicians, other qualified healthcare professionals, or agency are provided consistent with the nature of the problems and the patient and or family needs. Usually the presenting problems are self-limited or minor. Typically 10 minutes are spent face-to-face with the patient and or family. So these are just common CPT codes for different methods. Here's an example for a coding scenario. A 16-year-old female visits the health department and asks to be tested because she says she had been told that she had been exposed to an STD but doesn't know what kind of STD. She tells her nurse that she just wants to be checked to be sure she doesn't have any kind of STD. She has had multiple male partners. In that case, what code should we use? So we're going to use Z11.3 for the encounter for screening for infections with a predominantly sexual mode of transmission. That is the screening portion. And then we're going to use Z20.2 for contact with and suspected exposure to infections with a predominantly sexual mode of transmission. And then Z72.51 for high risk heterosexual behavior. Another coding scenario with ICD-10 code and CPT code would be 34-year-old single male attorney who reports to the walk-in clinic requests an asymptomatic STI screen since he engages in unprotected, receptive, and insertive anal and oral sex with men. The nurse practitioner provides 15 minutes of STI prevention counseling, swabs of mucosa of rectal and vaginal surfaces are collected, as well as a urine sample. For gonorrhea and chlamydia, and order the following tests to be drawn in the clinic phlebotomy station and sent to a commercial lab to test for serum HIV, antibody test HIV, RNA by PCR and RPR. So just one of the codes from the ICD that we can use would be Z77.21, and that code for a personal history of contact with and suspected exposure to potentially hazardous body fluids. And one CPT code we can use for administration would be 36415, and that is the collection of venous blood by venipuncture. So my second original flow training product is the process of creating and updating a billing guide. The purpose of my second flow training product will serve as an instructional guide for future healthcare providers and staff. This is important because first starting out, it can be very confusing and very hard to navigate through the endless research that they have out there for billing and coding guides, as well as some that are outdated or currently in use that need to be updated. So this guide provides the support to anybody, a team, an individual, healthcare provider, that it can take days and months or even years to just start somewhere. So this guide helps to take you step by step through the process that I went to create the billing and coding guide. Again, so the purpose is to help with the aid with the understanding of coding and billing and how it is put together. The language and coding can be quite difficult. It's very technical jargon that if you don't have experience in it, it's hard to understand. And this instructional guide will comprise of sections that I use in my billing guide and how I achieved to find my billing codes. So the first section should be an intro, a background, something that needs to be known. So for example, like for my first one, I'm doing STI, so I give a background on all the different infections. So for example, chlamydia is a common STD that can cause infections among both men and women. It can cause permanent damage to a woman's reproductive system. This can make it difficult or impossible to get pregnant later. Chlamydia can also cause a potentially fatal ectopic pregnancy. And what that is when the pregnancy occurs outside the womb. So that's just one snippet of what the guide should encompass and what it should entail your audience and the readers on what they're going to find as they keep going. There are websites for all kinds of information. The one I use came from the national STD curriculum because it gave in-depth information. It provided very explicit pictures in case you're a visual learner, and it also gave you many quizzes along in the reading to make sure you were able to understand. So that was a great source for me to get my understanding. And for any billing coding guide, healthcare related or not, there are always resources like this for you to get started and become a master in that field. The next section should include the ICD-10 and the CPT code, as well as any other codes that you may come across that you feel very relevant to your guide. It's a really good idea to put them in order to prevent duplicates or outdated code, because if you pull from 4 or 5 different guides, they can all loop together and just get very confusing, or one code may not be applicable, but one is. So it's hard, it's a lot, and a good place to start is just to start by just copy and pasting what you feel is the most relevant to the guide, and just keep it in order and be very organized. A really good example came from a guide done by the University of Washington. They outlined it really well, and they had such great examples there. It's very easy to read and very easy to understand. And then once you get that done, you want to provide some examples to see how it relates. So providing examples will show the audience that the research is trustworthy and accurate and reliable. Gathering examples from different guides is a good way to show diversity or it showed a good way to show diversity in the way that it codes, from medical healthcare to different environments to a pharmacy or a therapist. It's very, very diverse, and but it can all be very relevant. And also being able to cross-reference all the situations that fit the guide will help strengthen its purpose. Some tips and recommendations that I have for creating and updating a billing guide would be to find classes that provide information on the topic that you're doing a guide for. Register for webinars with professionals in that field and ask questions. Collaborate with different individuals or teams to get ideas flowing. Reach out to local clinics, hospitals, pharmacies, and ask how they bill for their services. And just stay organized and consistent. So now I will be talking about my competency that I felt best reflected my two original field training products. So the first one, apply system thinking towards a public health issue. So this applies to the billing coding guide. So we know in public health, research and evidence is very important. Li Chao et al. Implies four fundamental system thinking perspectives. Increase attention to how new knowledge is gained, managed, exchanged, interpreted, integrated, and decimated. Emphasis on a network-centric approach that encourages relationship building among and between individuals and organizations across traditional disciplines and fields in order to achieve relevant goals and objectives. The development of models and projections using a variety of analytic approaches in order to improve strategic decision-making and system organizing in order to foster improvement in organizational structure and function. This billing coding guide is encouraged by the increased attention on how new knowledge is gained, managed, exchanged, interpreted, integrated, and decimated. While the science and treatment for many STDs will rarely change, for healthcare professionals, it may alter the course of therapy and how it can be identified early on with the proper referrals and coding recommendations. All healthcare professionals, including doctors, therapists, pharmacists, nurses, and others, can stay current with this guidance and come up with new approaches to accurately code that are in line with the current endemic for STDs around us. The second one is applying principles of leadership, governance, and management, which include creating vision, empowering others, fostering collaboration, and guiding decision-making. This guide serves a greater purpose for a doctor to patient. The principle of leadership follows brief beliefs in the purpose, values others' opinion, and creates a vision. This guide is to help empower healthcare providers to provide the best care at the point of care for the patient and not overbill for a service that was not needed or to refer patients to other healthcare providers. The principle of governance, accountability, integrity, and empowering others come into play with the billing coding guide. A guide such as this takes time and dedication to complete. It's important to be held accountable and work effectively in a team to make this guide successful. The principle in management, fostering collaboration, and guiding decision-making, this billing and coding guide hits all of it. Essentially, this guide is geared towards management to prevent mistakes as well as guiding healthcare providers to provide quality care. The big point here is this guide is a guiding decision-making. It is not a firm guide that every doctor should be strict on. It is only to provide general information, and it's to be considered in coding for STI related services. But again, everything must be considered on a case-to-case basis. The third one is to evaluate policies for their impact on public health and health equity. A billing coding guide is essential for the quality care from healthcare providers to patients. This billing coding guide serves as a bridge so that the patient will receive quality care, the right care, and proper billing. A billing coding guide can serve as an extension to the missions and values of a workplace, as well as foster compliance. The policy within the billing and coding guide can benefit multiple parties, including staff, patients, insurance companies, and healthcare providers. A billing and coding guide can also be very important to insurance firms since if one is in place, audits can be avoided. If, however, this problem persists, it may reflect poorly on the business and its employees and indicate that there aren't any standards or procedures in place. A billing and coding guide is essentially a document that is developed for a specific workplace and should be used there. Perform effectively on interprofessional team. This is my competency for my second field training product. So in this case, the positive outweighs the negative. Collaboration and effectiveness among individuals with various educational backgrounds not only strengthen the validity of the research, but also increases self-efficacy and enhances patient care. Interprofessional teams have many advantages, including the ability to learn how to communicate with people from various backgrounds, enhance patient care, reduce medical record errors, implement treatment more quickly, help reduce healthcare costs, get the right diagnosis and treatment. And ultimately, it can foster a work environment that is healthy for everyone. A medical doctor may only have one specialty, but a nurse may be exposed to all the different specialties. With this type of knowledge, the nurse may be able to code accurately in the confirmed diagnosis, as opposed to a medical doctor who may diagnose and treat patients according to a different protocol that is not their specialty or of expertise, which may result in a discrepancy if the right procedures aren't coded and built right. It can cause an audit and a lot of mistakes, which is not good for the business, the healthcare provider, as well for the patients. Lastly, is my last competency is to select communication strategies for different audience and sectors. So in order to update or create a billing guide, verbal communications is a smart method since it enables team members to discuss their findings from the research phase as well as their opinions and ideas. Additionally, if it fosters self-confidence and trust within the group, and because everyone will be responsible for the same task, it will hold team members accountable for ideas to be expressed, research to be presented, community communication to be effective, and interpersonal trust to be developed. The area of public health needs ongoing communication. Finally, establishing or upgrading a billing guide works amazingly well when using visual as a communication method. To effectively convey the message to the audience and the team, visual can use a variety of images, videos, or audio files. My reflection on doing this was very rewarding. It's hard to start with no prior knowledge with coding and billing, but having someone as well as Acacia, she's very smart and very knowledgeable and very, very helpful, made this journey a lot easier. I learned a lot about code, STIs, and also how to communicate properly with billing departments when I had to reach out to them. Yeah, at first it was a lot of confusion and it just seemed a big pile of a mess, but it's really easy once you have a system, once you have a guide. So moving forward, I will take along with me the information gained from learning about different STIs and look at it from a different epidemiological perspective. I will also apply the knowledge gained from billing coding to improve my workplace and make sure that we are providing the best quality care. These are my references that I use for my information. These are the picture references, and this is my contact information. Please do not hesitate to reach out to me for any questions, concerns, or comments. Thank you so much.